Yvette Rowe, a Nyingana Yara woman from West Kimberley. I'm a Senior Research Fellow at Mater Research, University of Queensland, and it's my privilege to introduce to you Professor Sue Kildea, who has had an outstanding career in midwifery research across Australia. The research that she's done has helped redesign our health service, has been centred on engaging Aboriginal and Torres Strait Islander communities throughout Australia, has been putting mothers and babies at the centre of how we design health services.
I'm a nurse and a midwife and have been in these fields for about 35 years. I've worked across remote Australia, working for the Royal Flying Doctors, working in as a remote area nurse, up in the Kimberley, over in Arnhem Land and in the Cape of Australia. So I've had an extraordinary privilege, really, an opportunity to learn about Aboriginal health, to learn about remote Australia and the diverse people that have been in this country for so many years. I'm absolutely passionate about returning maternity services to rural and remote Australias and across Australia, and also to returning birthing services back into the hands of Aboriginal people who had control of birthing services so many years before we actually arrived on this land. So our research is it's participatory action research. It's on the ground, it's working with mums and bubs, it's working with communities, and it's really making a difference. We're seeing sustainable change, we're seeing significant drops in preterm birth, we're seeing fabulous changes in the workforce, and what we want to do now is we want to actually upscale it. So we've seen it in a couple of communities. Some changes we've made have been sustainable. Let's upscale it, let's roll it out across Australia. That's what we're passionate about.